So today I'm going to be doing a central line dressing change. Before I go into the patient's room, I'm going to verify the order and I'm going to change the dressing according to the hospital policy, which from what I've seen is usually every 7 days, or if needed for another reason. But I'd also gather all my supplies, like my central line dressing kit change. You're going to need a clean pair of gloves to remove the old dressing, and you're going to need a mask for the patient to wear. And you're also going to be wearing a mask, but that'll come in your kit. And you need a mask because you don't want any bacteria getting on the site that goes directly into their heart. That's a huge risk for infection, so you're just going to be safe rather than sorry. And then when I got in the patient's room, I'm obviously going to introduce myself, ask their name and date of birth just to verify that they are who I'm supposed to be doing the change on, and wash my hands, hand hygiene, all that good stuff that you're supposed to do, and provide privacy. So now I'm going to go do the dressing change. Okay, so I'm in my patient's room and I've introduced myself, confirmed the name and date of birth, explained the procedure to him. So now I'm going to put a mask on him. And if he can't tolerate the mask, I'd ask him to turn to the side and avoid breathing on his central line. All right, there's his mask. Then I'm going to put on my mask. And get a pair of clean gloves, and I've already washed my hands before doing this. So I've got my pair of clean gloves on to remove the old dressing. So what you're going to do to remove the old dressing is start at an edge and gently pull up. Make sure the catheter that's inserted is staying in place while you do this. Make sure you're not going to pull on it and get it out. Gently go around. You're removing the old dressing here. Alright, so you've got the old dressing off now. Your device is still in place. At this point you're assessing for any redness, swelling, infiltration, anything like that that you need to document. Okay, it all looks good, so you're going to move on to doing the site care. So you're going to open up your kit and get on a pair of sterile gloves. You're going to open your chlorhexidine, your ChloraPrep, to clean the site with. So you're going to activate that by pressing down on the wings. Then you're going to go over and you're going to scrub around the site gently but firmly. Make sure you get everything off there. It's nice and clean. Then you're going to allow that to dry. It can take around 2 minutes, so let that dry. Don't blow on it. Don't wave your hands or anything to make it dry faster. Just let it dry. So, now that you've got it clean, you're going to use your skin prep. And you're going to wipe that around the site, all around it. Give that a minute to dry. And then you're going to put on a new bio patch that you removed earlier. So this is just to help reduce the growth of germs. You're going to put it right up around the insertion site. You've got that on. And then you're going to get a securement device if you have one and a dressing. Alright, so that's all dry. Now I've got my dressing that I'm going to put on. It's just a clear dressing. Open it up. And you want to place it so you can see the device through it. And when you're assessing, so you can see any redness or anything around the device, try to make it as wrinkle-free as possible with no air in it. So the dressing's on, and at this point I'm just going to put my name and today's date on it so we know when to change it next. And then I am going to wash my hands, make sure the patient has his call light within reach and that he's comfortable. Remind him to call me if he needs anything. And we can take his mask off at this point. And then I am going to go do my documentation, so I'm going to document that I did site care and document anything that I saw. I document anything abnormal. This looked good, so basically I just document the site care, that the device is working, and that is all. So when I was watching my video to edit it, I noticed there's a couple things I should have done that I did not do. I should have checked for allergies before cleaning the site, just to verify that he didn't have any allergies to like a cleaning solution or anything. And then I also would have made sure the gown was a little bit further away because I noticed that it was kind of close watching it, so I'd probably take it off the arm and move it down, just to make sure the gown he's wearing does not touch his central line, because that's not good. Yeah, and I know that you didn't see a lot of me putting on my sterile gloves or the sterile field, because I had it all focused on the central line, but I've done that in past skills, so I hope that's okay.